All right, welcome everyone. I hope you are all doing well and really taking care of yourselves during this time. First, I would like to introduce myself. My name is Alina. I am the Cross-Cultural Center's Jim Lynn Alumni Relations and Development Intern and Social Justice Educator. I am a fourth year majoring in Human Biology and Sociology, and I will be facilitating this event. And I will pass introduction to Edwina.
Good evening, everyone. I'm Edwina Welch, and my gender pronouns are she, her, hers, and I am the director of the Cross-Cultural Center and have the fortune to work with Alina as our alumni engagement intern. I am so excited to see these two folks tonight and to catch up and be in community with you all. So welcome.
Thank you all for joining us today. To give a background of why we implemented this program into Alumni Roots, Alumni Table Talk is a program that was created for alumni to share their personal and professional experiences to current students, and a space for students to ask questions as they embark on their own journey. And our Table Talk theme today is social justice and public health. Before we get started, it's important that we give a land acknowledgement, even though we are virtual. The San Diego community holds great respect for the land and the original people of the area where our campus is located. The university was built on the unceded territory of the Kumeyaay Nation. Today, the Kumeyaay people continue to maintain their political sovereignty and cultural traditions as vital members of the San Diego community. We are honored to share this space with them, and we thank them for their stewardship. This was adapted from the UCSD Intertribal Resource Center. And before we keep continuing, I forgot to put on the closed captionings, but also disclaimer, the closed captionings might not always be accurate. And then also I will be taking the slide down once we get started with our roundtable, but I can enable the live transcription so you can see closed captioning on your screen. Just a quick overview of how things will go. We'll start with panelist introductions, where you'll get to hear a brief background, and then next we'll move into our roundtable discussion, and then we will most likely continue our roundtable discussion during the breakout session, and then we will have our closing statements. So now it's finally time to meet our lovely panelists. If you could each give your name, pronouns, year you graduated, college and major, and then maybe a little bit about what you were involved in as an undergrad, and then your current role. Heidi, if you could go first.
Oh, me first, okay. Hi, my name's Heidi Kelly Twasson, and I graduated from UC San Diego 14 years ago in 2007. And my majors were, I think I finished with a double major in biology and ethnic studies with a focus on Filipino American studies. And you graduate, oh, I go by she, Sha. Sha is a genderless Filipino pronoun. And what I was involved in as an undergrad, I was Summer Bridge 03. I worked at Oasis. I worked at the Cross-Cultural Center. I was part of Kaibigang Filipino, as well as what's now called Kabayanihan. I don't know if they're still around, but they used to be called Filipino Students Saving Tagalog. And then I was part of Kamalayan Collective, which I don't know if that's around either. I was also part of APSA and other things, and I really missed the old building. I got to be an intern in the old building when it was the last year, and we got to paint all the walls. And my current role, I was working for the health departments, local health departments here in the Bay Area when the pandemic broke out, and I was pregnant, so I decided to hide out. And now I work at UC Berkeley at the School of Public Health as the Assistant Director of the Center of Excellence in Maternal, Child, and Adolescent Health. And once the pandemic is over, I will go back to working in the field. But for now, I am, yeah, I'm there doing research and advising students.
Thank you, Tiffany.
Hi, everyone. My name is Tiffany Chan. My pronouns are she, her, hers. I graduated in 2018 with Sixth College, and I had a double major with public health and ethnic studies. My involvements in undergraduate were similar to Heidi's. I was also in APSA. I think it was called Kaibigang Filipina, KP. I was a social justice educator as a CCC intern for my last year. I was also somewhat involved in my Sixth College. I worked as a front desk receptionist and helping advising students. I was involved in this program called the Life Course Scholar Program. I'm not sure if it's still called the same anymore, but it was volunteering with senior centers. And they had events at the end of the year. So I remember coordinating a senior prom at a senior center nearby in La Jolla, which is probably one of the highlights of undergrad. And then I was also involved in the Blum Summerfield internship, where I provided like mentorship and education to elementary school students at Encanto, which is, I think, Southeast San Diego. And that was a really good experience. I also was a summer research associate after I graduated for UC San Diego School of Public Health. I did a research study on marijuana and how its proximity, marijuana dispensaries, proximities to schools, does it have any impact on minors, getting marijuana that are, even though they're not allowed to. And I think my last one was I volunteered with the Asian Pacific Foundation, and I did a lot of clinic stuff where I measured patients' BMIs, height, more clinical based, which was really fun. And now I'm working for the Centers for Disease Control and Prevention. I'm a public health advisor here at the Washington State Department of Health. So I'm currently in Washington State in Seattle, and I have been just working on COVID. So when COVID hit, COVID hit when I moved here. So I came here working on COVID allocation. So just figuring out who to give vaccines to and how many, and figuring out, the allocation process is very difficult because there are a lot of factors to take into consideration. So that's what I did. And so far it has been challenging, but also very rewarding. And now it's slowed down a little bit, but I can definitely talk more in depth about everything I've done with CDC during the breakout sessions or in the next questions. Thank you.
Sorry, skipped ahead. So now we'll go ahead and start with our roundtable. So I'll stop sharing mine. And to get us started, I'm going to go back to you, Tiffany. How did you decide to become a public health advisor, and what does your day-to-day look like? I guess you can speak on it about after COVID hit and maybe before, I don't know, either way.
Yeah, of course. So I entered CDC after undergrad. I applied to a fellowship called the Public Health Associate Program. And when I got accepted, they place you in different field sites. So I was placed at the California Department of Public Health, where I started working on an environmental research study called the biomonitoring, which is basically measuring the levels of chemicals and toxins in people's bodies. So we did a lot of sample collecting and outreach to communities in San Diego and SoCal. And that was something I did for a year and a half until COVID hit. And when COVID hit, I got deployed. So CDC calls it a deployment, but I flew over to Chicago, where I was at the quarantine station screening passengers for COVID, and particularly flights coming from Wuhan, China. And then soon they opened it up to any flights coming into Chicago. So I worked there for about a couple months, screening passengers, taking their temperatures, asking if they had any symptoms of COVID. And this was before COVID went into full lockdown, so we didn't really know the severity of it. And it's been crazy because I've been there for the beginning all the way to what it is now, working on COVID, which is a really good experience. And after working in Chicago for a couple months, I went back to the California Department of Health, where I worked with the governor's office in California to procure test supplies, and working with FDA to make sure that masks and nose test swabs are FDA approved to be sent to hospitals where nurses and healthcare professionals can use them. And then after that, my fellowship ended. It was a 2-year contract. And so I was able to apply and transfer from the California Department of Health to Washington State Department of Health, where I moved in October of last year. So it's been about 9 months or 8 months since I've been here for the Washington State Department of Health. And I immediately jumped onto the COVID team. I hit the ground running, where I was the co-lead for the allocation team. And that was a lot of work, where we figured out, who are these counties in Washington State, and how can we how do we allocate appropriately and equitably? There's a lot of considerations to take into account. There's a lot of disproportionately, or there's a lot of communities of color that have been disproportionately affected by not being able to get COVID vaccine. And there's a lot of stigma. And how do we work around that, as well as working top down with CDC, to the state government, to the local counties, to the providers who are doing the outreach. And so it was doing a lot of communication back and forth, and also working with private partners like Microsoft, who helped us build a comprehensive database, and to figure out, all these different factors, and working with other Department of Health partners like the equity team, long-term care pharmacy programs, where they focus specifically on elderly populations. And I would say the first 6 months, I was working 70 hours a week. It was a lot of work. And now that supply has exceeded demand, everything has slowed down a lot more. So I'm no longer working those crazy hours. And I feel like it's been a transition period, where now we have an excess amount of vaccine, and whoever wants it can get it. But it's now figuring out, who are these people that don't want it, and how can we how can we approach vaccine hesitant communities to give them the COVID vaccine and protect them. And that's where we are now. I am still on the allocation team, but now our approach has changed, just because the pandemic has changed. So it's been a lot of adapting and being flexible with what the pandemic has been like, but also trying to take care of myself and take care of the team, and making sure that the work that we're doing is sustainable, because the pandemic burnout is a really big deal, and you hear that healthcare professionals experience it. But us on the backside doing the administrative or logistical planning work, it's also a really big burden. And I'm really happy to say that I think the hump has passed, and now we are doing work, but it's not to the point where it's very fatigue based.
That sounds like a lot of responsibility. And
Yeah.
thank you so much for your hard work. I definitely commend you for being in your position, especially during a pandemic. So thank you.
Oh, thank you. Mm-hmm.
Heidi, the next question is for you. Can you talk about how you decided to pursue a doctorate program in community health sciences? And then also, can you talk about how you decided what to study and just that overall experience?
I love that we jumped to where I am now. So when I got out of undergrad, I am so jealous that you have a public health major, and that there's a master's. I just looked it up because Edwina was like, yeah, there's a master's program. I had no idea, because none of that existed when I was a student. I was a bioengineering major as an undergrad, because I wanted to make fake hearts or something. And then I started becoming a student activist, and sitting in my biology classes just did not meld with my values of working with community and social justice and things like that. Not that there aren't ways to do it. And I totally know folks who have become nurses, nurse practitioners, and doctors, and are totally doing it in a social justice way. But that did not resonate with me. And so after I graduated, I was like, what the hell am I going to do with an ethnic studies degree and a biology degree? Like, it's either I go into biotech or I don't know. So I stumbled over this program called AmeriCorps, which has its own controversies, but it's like the Peace Corps, but they send you somewhere in the United States to an underserved community or something, whatever that means. But that experience allowed me to work in a community clinic, and I fell in love with community health. And so that's the long answer to your short question of how I decided to pursue a doctorate. There's many things that have happened along the way that have made me want to pursue a doctorate. And part of it is frustration with the systems. Sorry to say, Tiffany, but I worked a lot on the ground with communities. I'll talk about this later, but I worked with the Cambodian, Lao, Filipino, Samoan communities, organizing them so that they could advocate to this Department of Public Health for services that were culturally appropriate for their communities. But I found that many systems, most of research, a lot of funding comes with a very white lens and frame of mind with how they measure success, approaches to community and health. And so viewing health as like an individual decision and not taking into account kind of historical things that have happened to these communities, and that's why they don't want to get the vaccine or whatnot. And so long story short, is I'm currently getting a doctorate in community health sciences at UCLA. And I have a minor in Asian American Studies and Health Services Management. And my dissertation is looking at childhood trauma as a proxy for intergenerational trauma and historical trauma, and how it affects suicidal ideation among Filipino Americans. And looking at generational differences, including first generation, second generation, but also 1.5, 1.25, 1.75. And I'm even splitting that up into like 1.08 and 1.16, like these like micro generations. If you immigrated here, not just as a young adult or a teenager, but also what about as a child or as a toddler? And what does that mean for your experiences and development? And so that's kind of what I'm looking at. I'm also looking at community involvement, ethnic identity development, language use and knowledge, and homeland connection as buffers between trauma and suicidal ideation. And I mean, all of this stems from the stuff that I learned at the Cross, like what was it? 2005, I was in this class that we created, and we sat on the floors of the Cross-Cultural Center called Pinayism, and we studied Filipino issues. And I know Nancy was like a speaker and would come in, and like it was through those conversations that like I now, and you know, as a Cross intern, these kind of critical perspectives on the world, on in my field, outside of my field, in education, as an educator, because I also taught at UCLA and then at Cal State LA. That all kind of brings me to why I wanted to study and why I never thought I was going to get a doctorate. Like I was like done after the master's, but I realized that the systems are so effed up that I needed, sorry, I'm not supposed to say that, but that I wanted to change how things were measured, how success was defined, so that communities that I care about and work with who don't necessarily get to sit at those tables of decision making and policy making that programs and funding actually get to the places that they need to be rather than the places they usually are. So that's why.
Thank you. Yes, I can definitely relate to that, like, transition and changing, exactly what you want to do with the career or in your future career, because I had the same dilemma. I knew going into a STEM field would mean, having to suppress my activism, but I didn't want to do that. And I wanted to find a way to find that balance. Thank you, Heidi. Tiffany, back to you. Can you talk about more about the extracurriculars that you were involved in and how it helped you in your position now?
Of course. I would say that my extracurriculars informed what I wanted to do after undergrad. So being involved in APSA, which is the Asian Student Pacific Islander Alliance, the Cross-Cultural Center, KP, they were all very social justice based. And that's something that I felt gave me a purpose because I think my first 2 years of undergrad, I felt very lost. I came in as a neuroscience major and not really liking the major. I didn't like the STEM classes and I felt like this wasn't right for me. And then when I found public health, and when I changed my major from neuroscience to public health, it gave me more clarity on what I wanted to do. And then when I found the Cross-Cultural Center and all these organizations, I realized that, I do want to add a double major with ethnic studies. And so I think that finding community was really, really important to me. It practically saved me when I was in undergrad because undergrad it can be a very tough place and it is really hard when you don't have community. And I felt that especially my 4th year, when I was an intern, the CCC felt like such a safe space for me to relax in, to study in. I always felt like I had a place to go in between classes. And then the community I met was so strong that, even to this day, I tell friends that I still feel really connected to the CCC. And I would recommend, did you ask what you would recommend for others to participate in? Okay, yeah, so I would recommend for undergrads to try to explore and find community. I think that it's one of the main things that is super important, especially in college and when you're trying to find your niche. And I think that being in the Cross helped inform my decision to work in health disparities. And I'm still trying to figure that out, having been with CDC for a couple, or almost 3 years. I do agree with Heidi that the systems are very broken and I don't know if I want to continue staying where I am. I think there is a lot more exploring for me to do in terms of public health since it is such a really broad field. But the experience that I've gotten volunteering when I was in undergrad and also working at the CDC, it's continued to help me inform where I want to go next. And that might not necessarily continue with CDC. It might be in another sector, whether it be private or nonprofit. But ultimately, all of this has been rooted in social justice. And I still am very passionate about working in health disparities and I think I would want to work more community level or community grounded level still.
Definitely need you at the CDC though, too.
Thank you. Heidi, you might have touched on this a little bit, but what was the work that you did in your nonprofit community clinics? And maybe can you explore how this was different from the US versus like in the Philippines, the work that you did?
Sure. I started off right out of undergrad. So I was in that AmeriCorps program and I was a frontline worker. So I worked at a community clinic and we were a staff of 12 with like maybe 50 volunteers, which were more like interns because they had regular shifts every week. And I was the assistant clinic manager because I was 22. There was two of us. We were the assistant clinic managers. And but I started out just working at the front desk, so greeting patients. And it was called the Women's Community Clinic. My work hours were all weird because they wanted to accommodate women who were working during the day. So I worked from like 1 to 9:30. And then I worked on some Saturdays. But I started out at the front desk, and then I became like a health educator, medical assistant. And then I was a HIV test counselor, pregnancy test counselor. And then I did also street outreach with homeless women in the Mission District of San Francisco. And then I was also supervising clinics. Certain like shifts would be like my clinic, and I was in charge of all of the staff and all of the front desk, and making sure that all the patients were happy and were being seen and everything was going well. So I started out really on the ground doing patient-to-patient work. And then I went to get my master's, and then after that, I went back to community clinics, but this time kind of on the grant writing level. So then the programs that we were running, like street outreach or something like that, I would help get funding for that by writing grants. And then I worked at La Clínica de la Raza, which is a federally qualified health center in Oakland. They have like 30 clinics now, but they started out as like just a storefront in the 1970s, led by student activists who felt that there needed to be health services for in Spanish for the Latino community in Oakland. So then I went there, and then I loved working with the Latino community, but my heart was really with the Filipino community. So I switched over to working with community-based organizations that were trying to get health services for their community. So that was the Samoan, Tongan, Fijian, Cambodian, Lao, and Filipino community, and Vietnamese communities in San Francisco. And those were like community organizations. They were not health organizations, but they knew that their communities needed health services in their languages. And so the best way to build that is from the ground up, not from like, okay, SFDPH tries to find people that speak these languages and then try to somehow like place them in the community, even though they're not from the community. And so I really liked that they were taking this approach. And so it was my job to gather all the folks. It was essentially community organizing, things I did at the Cross. It was very much SJE or DPE types. And then we were able to get a $2.5 million grant from San Francisco, get served community centers, specifically mental health services that were culturally and mentally appropriate for those communities. So that's kind of what I did at community clinics. And then I also did this thing in the Philippines at one point, and just a summer internship, but I mean, language is very different. I don't know how else you want me to, international is similar and different than domestic community clinics in just that there's so much. When I was in the Philippines, we were dealing with like all kinds of things. Like we were trying to pass the reproductive health bill because contraception was viewed as like illegal or was seen as like abortion. And so we would go out into the slums and bring, like the poor areas, and we would organize with community members and provide services, but we would also organize them to then go to Congress. And like we would have like big banners and be like trying to convince these Congress folks to pass this bill that would allocate funding for more service. But it was quite the adventure, and I was not a fluent Filipino language speaker. So I definitely improved way much during that internship, even though I studied abroad in the Philippines during my undergrad. To the point that now I teach language at UCLA. So learned all kinds of things, and community clinics are really where my heart is at, because it reaches people where they're at. I also worked for Asian Health Services, but that was just like a little.
Thank you. Also, a follow-up question. Did you happen to notice like any trends about when in terms of like health literacy, depending on like the area that you were doing the work in?
I mean, health literacy is a interesting term and concept. I think if it's measured in a certain way, I think communities are the best at knowing themselves. And I think we need to start at a point of feeling that communities, that folks in the community can be experts for their own health, and that we're that is because health literacy is often used in such a way that dumbs down communities and expects them to think about things and know things in a specific way. And I think, so to make this less abstract, at La Clinica, we did a lot of partnership with the community indigenous healers, who use things like ceremony and dance and healing ceremonies and like burning of herbs and things like that. And that was more effective than any kind of space program that was developed somewhere else in the United States, that we could have asked the community to participate and come to like a 10-week session to develop their health literacy. So I have a little bit of mixed feelings about this term, obviously. But I think that if we think about public health as less of doctors telling people what's best for them, but rather drawing from the strengths of what communities already know about their health and partnering with them, I think we will go a lot farther. So, but that is just my view on things. I also would love to work at a health department at some point, but I think I would need to find other people who get what I'm saying. And there are definitely folks that are critical and think about equity and not just disparities. Think about what does health equity mean? So yeah, sorry, I could say lots about this, but I will stop.
No, that's great. Your passion shines through. Thank you. Tiffany, how do you feel that your undergraduate majors, ethnic studies and public health, prepared you for your position now? And then also what was the benefit of having an ethnic studies major?
Yeah, that's a really good question. I think that ethnic studies and public health intersect very well together. And in terms of health equity, I definitely think that's where my interests align, which is why I decided to double major with ethnic studies and public health. I think it is a little bit challenging to be working in government with this lens, because I have met a lot of people who don't have that lens. like Heidi was saying, and coming straight from undergrad to working at a health department, it was difficult to navigate that and trying to figure out the balance with my team, and also looking at programs and grants and just agendas for communities from a health equity lens, but also working from the state and the federal government. And I think that my position, or these majors, have allowed me to look at my position from this lens, but it's also made it a little bit more difficult to figure out how to work with different bureaucratic policies and partners that don't necessarily share the same outlook. And that's been my experience for health departments and also with CDC a little bit. I would say that there are some aspects where I do agree that, you know, work needs to be done and that partnerships are really, really important. Ultimately, I do think that the community knows itself best as well. And I think I know this because I have an ethnic studies degree, and all the knowledge that I've gained with UCSD and the CCC, APSA, and all the extracurriculars have supplemented me with this knowledge. So I feel really grateful to have had these experiences and to have this kind of lens to be able to look through. And what was the benefit of also having ethnic studies degree? I learned a lot of praxis. I learned how important praxis is because a lot of my public health classes when I was an undergrad, it was very textbook based. And so we would learn a lot about like statistics and occupational health and different diseases. But to be honest, a lot of the work that I'm doing now doesn't really come from the textbooks. A lot of the experiences that I have and things that I'm learning are because I'm doing the work itself. And I think that ethnic studies has really emphasized, you know, putting in the work, praxis, and having experience and on the ground experience. And that's something that I really appreciate because what you learn in a textbook doesn't necessarily transfer 100% to what a community wants or how to navigate situations. It's a lot different in the real world. And so that's what I've learned is the benefit of having an ethnic studies degree.
Thank you. Yes, that's great. Heidi, can you also touch on this question?
Sure. I mean, I think I bring a different lens to things, to the classroom and to the questions that are being asked because of my ethnic studies background. And I think like, for example, so I'm a mixed methods researcher and I do community-based participatory research or whatever, or blah, blah, blah. They're just terms for like interviewing versus doing a survey. And I think that having an ethnic studies degree shapes how I ask questions and shapes how I think about solutions and shapes how I look at a health issue and what are the factors that are affecting it. All public health folks will think about individual, interpersonal, community, systemic, institutional, you know, all of those levels. Like that's the socio-ecological model that everybody learns at Public Health 101. But not everybody is thinking about history of slavery or bombings and wars and how they did other countries. Not everyone is thinking about intergenerational and transnational movement. Not everybody is thinking about trauma as it gets passed down in the body through our cells because of, you know, histories of colonization and loss and how that affects the body. I think with that, yeah, I think my ethnic studies degree gives me a different lens that allows me to ask different questions. And I love, there are many things I don't love about my UCLA program, but one of the things I do love about my department is that a couple of my faculty started the Center for the Study of Racism, Public Health, and Social Justice or something. I forgot exactly what it's called, but it's the first semester I was at UCLA, I took a class called Racism and Public Health, and it is hands down still my favorite class. And then we talk about also critical race theory in public health. And I had not encountered anything like that when I was getting my master's in 2008, 2010. The reason that it's taught that way is because now the up and coming faculty, some of them have a joint appointment with African American Studies and Public Health, or Asian American Studies and Public Health, or Latinx Studies and Public Health. And that mix of disciplines is something that is I had to struggle with going back in those disciplines, but now they're starting to be better integrated, both in praxis, and in theory and in academia. So academe, I'm sorry. But so yeah, I mean, I think I'm including historical trauma and colonization and immigration as part of my variables, when another researcher might be looking at the same question of childhood trauma and suicide and not look at that at all, and not think about generations, and not think about, or they'll define acculturation in a specific way. And that's like, I'll disagree with that. I'm like, it's not just about this and that, it's about other things. And so I think as with the ethnic studies degree, it's given me a critical lens, but it's definitely, there's still many silos. I'm part of the Association of Asian American Studies, and I go to that conference. I go to the Asian American Psychological Association conference, and they have a very different clinical lens. I go to the American Public Health Association, conferences, and I'm part of the board of, I was part of the board of the Asian Pacific Islander Caucus, and they view something in a very different way. So like, I feel like I'm able to meld all those fields when, yeah, because in Asian American Studies, that conference is all head, and it's all like, they come up with these new terms, ethnic studies terms, and like, it has nothing to do with practice. And then at Public Health, they like are all about the practice and like, don't think about the theory of like, okay, why do we think this program is gonna work in this community? So I love that I get to mix them, but I don't think I knew that in undergrad that was possible. So, but Edwina may vision it and think about it and dream that it was possible.
Thank you. I appreciate your response. Tiffany, what are barriers that certain populations face in accessing healthcare resources that we don't realize or maybe isn't given enough attention? And maybe how have these worsened due to the pandemic?
Yeah, that's a good question. I wasn't sure which way to go about this. I feel like personally, I experienced barriers. And so in terms of personal and family, like the lack, I know that I grew up in San Francisco, Chinatown, and my grandparents live in San Francisco, Chinatown. And one of the reasons why I decided to go into public health was that they weren't able to go to their appointments all the time. Like they don't drive and they aren't near a bus stop. And so I think lack of transportation is something that it's a lack of resource that we don't realize for people to go, to just get a checkup. And so they miss a lot of their checkups because they don't want to spend money on like a taxi or Uber or anything. And I mean, they don't know how to do that either. And also not having a lot of representation in healthcare professionals. personally for me, I am most comfortable when I see an Asian American female doctor. And then when I moved here to Washington, it was hard for me to find someone that I felt like represented me. And then same for my family too, when there's a lot more Asian American practitioners in San Francisco. And then when I moved out of state, I found it a lot harder to find like a doctor and other healthcare professionals that I wanted to see that I was used to, represented me. And so I think things like this aren't given enough attention. And especially, I want to emphasize mental health. Like my family, we're Chinese American, or I'm Chinese American, and there is a lot of stigma in mental health among my family, and I think a lot of Asian communities where people that are battling depression and other mental health illnesses aren't necessarily seen as able to get help because of the stigma that surrounds them. And so having family that has mental health illnesses like depression or anxiety, it's hard to find a professional that is also culturally, I speak Cantonese, and so it's been hard for me to find like a Cantonese speaking mental health professional for family. And that's another barrier that I realize is not given enough attention. And then it comes to the question, like, why aren't there a lot of Cantonese speaking therapists or psychologists in the area? And maybe because, there's also stigma from going to profession in mental health from Asian communities. So there's a lot of lack of access to resources that aren't given enough attention. And especially due to the pandemic, I would say that, COVID vaccine is a really big example where because of remember the Tuskegee study, there's a lot of mistrust with government and their use of vaccines where, so the Tuskegee study, they had a lot, like experimented on Black folks. And that is it's a very painful memory. And so it's really hard to have communities forget about that. It's not something that you can easily disregard. And I noticed that, ever since working at the health department, there has been a lot of vaccine hesitant communities of color in Washington state, especially with the tribal nations. Washington has around 38 tribes, which is a really big portion. That's a lot of tribes compared to California, considering the size of Washington. And so I have not worked with tribes directly, but I know that in the beginning, there has been some hesitancy with tribes getting access to vaccine. And I know that some of our partners have been working closely with tribes, but there is still underlying mistrust and tension that is palpable, but also it's hard because they're working with the government to secure a vaccine. And a lot of the times the processes can be very slow moving and not community centered. So I kind of see both ways where working for the government, there are a lot of resources and funding available more so than in smaller clinics and communities. But at the same time, there are a lot of resources, or there are a lot of lack of resources and access that we aren't giving enough attention to. And this lens is something that it's important to me because it's very personal, and having my family go through this and me having to struggle through this too, it's something that I'm still trying to navigate and also see if I can help out with it with my position here at CDC.
Thank you so much. Thank you both for your amazing responses. This has been great so far.
Experiences are very unique to public health. I think Tiffany offers a lot of the infiltration within the system and trying to, I don't know if the word is institutionalize like social justice, but trying to like understand how to fix things within a broken system. And then Heidi gives a lot of the, she gives a lot of that grassroots organizing, and also community like based what's it called, praxis, which I really appreciate too. So I do have a couple of questions after this.
Yeah, it's really nice to share space with you and be a fellow panelist after being on, watching you be a panelist. So I feel like it's full circle.
All right. You know what? I think we can get back to our roundtable. Also, I know some attendees had some questions, so feel free to ask those. But to get us started, from both of you, I would like to hear, do you feel women are underrepresented in your public health field, like in your career, in both actually career and academic setting?
Go ahead, Heidi.
In general, public health is actually quite female dominated. But it's not, in terms of like male, female, like maybe it is female dominated, but in terms of other kinds of equity issues like race, ethnicity, socioeconomic status, gender diversity, I think that there's still ways to go. So that is my short answer.
Yeah, I agree. My experience in public health so far has been I've worked with mostly all females. My team right now is all females, but they're all white females. And and my old team too were mostly all white females. I would say the department were about 80%. And then within the people of color, I was the only Chinese American. And on my team right now, I'm also the only Chinese American. So it's interesting. I feel like there are, yeah, like what Heidi was saying, male, female, it's mostly female dominated, but in terms of race and class, socioeconomic status, there are some disparities or disproportionate areas that are not, I think because they're not at the table, there's not as much emphasis. And I think for me, what I bring to the team is more of a health equity or social justice lens. And I have to be cognizant of how I bring that to the table, because a lot of the team members are don't have that lens. And it's a lot of like unlearning or relearning and figuring out how to say it so that my team is receptive. And luckily I have a couple amazing teammates who think the same as I do. And they are receptive. And then there are some people that aren't at all, and they don't, they're there to put in the work. And then at the end of the day, they just go back home. And it's interesting to come across people like that, because like the impact that we have at the state and at the CDC is so large. Like we are allocating vaccine to thousands and hundreds of thousands of people. And so every small decision counts, and it impacts a lot of people. And so I take that into account, like the numbers that we see in terms of vaccines, like each one of them goes to a human being and goes to someone in a community. And I don't think that some people on our team necessarily see that. They just see like numbers. And so even though it is more detached from the community, I try to find ways to think about it where we are pushing out these vaccines to go to these communities, and they're not just numbers, if that makes sense.
Yeah, thank you. I'm wondering the trend, like what that has to do with Um, Also, I was wondering if you both could answer which of your personal and professional traits, professional skills, help you in your career the most.
So I bring a different, I think the thing that makes me a unique public health professional is that not only my ethnic studies lens, but I also am a naturally creative person. So my husband and I are also musicians. So we're actually paid musicians, and we play for musical theaters, and we play for churches, and we make, you know, a couple $1,000s a year, maybe like $10,000 or $20,000 a year on gigs. And it's not going to pay our mortgage, but it is a part of our lives that we love. And I think being a musician, I also like paint and make earrings and obviously appreciate art. But I also make documentaries. I learned how to make a documentary at UCLA's Asian American Studies department. They have a class called Ethnocommunications, where you learn how to create films with an ethnic studies lens for about and for communities that are traditionally not represented in media. And so I learned how to do that. And then I also worked at this place called the Center for Digital Storytelling, where I facilitate workshops with community members around stories of HIV. And I worked with the API, Asian Pacific Islander Wellness Center, and did a bunch of stories around HIV. I worked with another organization around mental health. And then, so I think that, and I really love, I love figuring out how to use art in theater. And I think one of your other questions that you had sent me was around the street theater program that I helped write grants for the Latinx community in Oakland around domestic violence. And I think some of these, there are very traditional ways to do public health education. And it's, they call them evidence-based practices, and they're developed in primarily white communities. But these are the ones that have been researched, and these are the ones that get funding, and these are the ones that they try to spread to other communities. But they're not necessarily the most effective. And so I think through using some of these other mediums of and finding creative ways, like gardening for Cambodian elders as a way, creating community gardens so that they will go out and exercise and walk together, and then maybe talk about their trauma, as opposed to, okay, let's fund a program where they meet 10 times a week, sit in a circle and talk about their trauma. Like, it may or may not work. And then at the end of the program, they're like, oh, why did nobody, how come everyone dropped out, and things like that. And so I think that creative lens, I feel very excited about it, that there's emerging research that is being done to validate these kinds of practices that have been done for generations in communities, and yet they're not validated by the academic circles. And so then policies and funding are not going toward those kinds of things. And so I think that's part of the reason also why I went into a doctoral program, was to then give voice to things that communities already know. And it's not like we're writing down anything new, because we're not, even though other scholars will be like, oh, look at this new thing that we do. I'm like, that is not new. That has been done for thousands of generations. Like, they're like, oh yeah, yoga for mental health. I'm like, don't even get me started. Anyways, So like, we're not writing down anything new. It's that we are writing down what our communities already know, and making it palatable and to be used by funders and policymakers to create change in public health. Anyways, I'm going off on sidetracks, but yes, that is, and that's also why I love mentoring students. One of the programs I ran at UCLA was the Community Development and Social Justice Scholars Program, which worked with first generation college students and historically underrepresented students to help them get into the fields of public health, social welfare, urban planning, public policy, and labor workplace studies. For that very reason that, like what you were saying, Tiffany, about not being able to find a Cantonese speaking mental health professional, it also has to do with educational access and the history of not being able to access, like folks are not even graduating from high school and college. How are we going to get them to even go into higher education and then go into those fields? And even if they do get to that place, how do we get them so that they don't graduate with so much debt that they have to take the position that's higher paying somewhere else that is not community-based? So how that was the problem I was encountering at La Clinica, is that we would get this grant to get a Spanish-speaking, bicultural, bilingual folk from the community who had an LCSW to work with community members around mental health, but we couldn't find those candidates who would take the pay cut to work with our community clinic because they're trying to pay off their loans. Like, of course they're going to take the higher paying job at Kaiser, and so educational access is another passion of mine other than public health, for this very reason that we need to diversify our workforce in order to actually make the change that we want. And I want to see more folks that do have this critical lens sitting at the tables of discussion, and who are the funders and who are working at the CDC and who are, and I don't want just tokenized folks of color being hired and then the organization bragging like, oh, look at our diversity, when it's actually, just because someone identifies with a certain or checks off a certain box does not necessarily mean that they know that community or are community based. So anyways, I could go on and off about this, but go ahead, Tiff.
I would say a personal trait that I developed was being flexible and adaptive. Like, I think that is a big part of my job, is just especially with the pandemic, a lot of things are constantly changing. I would say that, for example, this year, working on the allocation team, something can come up every single day where we find out that we don't get as much Moderna vaccine as we anticipated. And then we have to figure out last minute, how do we cut 10,000 doses? And this could happen like multiple times a week. And so it's a high pressure situation to figure out these numbers and how to make them match and how to make it equitable. But then this is happening every single week. And our team was only a team of 5 initially. And so and I got pulled on really early on, but I didn't anticipate that it was going to be so much, like our workload was just so high in terms of reaching out and outreaching to providers, local health jurisdictions, other partners, and then also figuring out how to allocate Moderna, Pfizer, Johnson & Johnson vaccine. And then also helping out with any questions that providers might have. For a lot of providers, it's a first time for them ordering vaccine. And this gets into the technical aspects of who is able to even place an order, and where does that education come from? And, having to educate providers and giving them a chance to order vaccine is also something that I saw kind of slipping through the cracks. Like, of course, Kaiser, Seattle Children's Hospital, like these really big name hospitals, they already have the emergency, or how do I describe, they already have the electronic health records and systems that are easily compatible with the state. And so it's easy for them to just hook their system onto our system and just order. Whereas these smaller clinics that are more like pediatric clinics, family run practices, FQHCs, federal qualified health centers, smaller pharmacies, they needed, and it makes sense, they needed a lot more handholding because they didn't have these big emergency or electronic health record system that were compatible. And then they, in their process to go through being able to order vaccine from the state and figuring out that whole process was a little bit trickier because they don't have the institutional knowledge of doing that as these big other Kaisers and hospitals do. And so it was a lot to navigate and also figure out that, but at the same time, being flexible and adaptive was something that you needed to have when you're in this working situation and environment. And so all of us had to pivot every single, or whenever something came up, like the governor had a request for us to return something in half an hour. And so things like that it was a really stressful time during the first few months. And then when vaccine supply started coming in large quantities, like 400,000 a week, we were slowly able to just give orders to people or give vaccine to people who requested it, and then have more time to hire more staff so that they could do outreach and figure out where the gaps are missing. I think that my time with the pandemic has definitely forced me to become more adaptable and flexible, and just also know or help me realize like what kind of work do I want to be doing in the future. Vaccine management is something that is, I would say, you don't think of it when you think of a health profession. Vaccine management is very logistically based. We have a huge database, and it's a lot of numbers and spreadsheets and working with databases. And it's helped me realize that I don't know if I want to necessarily go down this route. There are other routes that are public health that I think I would enjoy a little more, but I also think of every opportunity as a learning opportunity. I don't regret this position, and I love that my team and I have a really close bond, and I was able to get this experience. So I would say overall, it's been a really great experience. The days were very long, but the outcome, I feel so much more prepared for whatever comes next. I have been thinking about grad school and getting an NPH. And so maybe after this position, I've already started looking a little bit about grad schools. And so that's something that is on my radar in the near future as well.
Thank you very much. Oh, go ahead, Edwina.
I'm smiling because for the both of you, there's now actually a School of Public Health at UC San Diego. And the person who is running it does health disparities, looking at redlining and environmental, African-American women, looking at environmental justice, redlining, housing. And it's going into its second year. So it is not very old at all.
Oh, that's awesome. Yeah, I'll have to look into that. Thanks, Edwina.
I don't know if I convinced my husband to let me become a faculty there, but it's good to know.
All right, I know a few of our audience members had questions for our panelists. I just want to give you that moment. I think Marianne had it. Give you a moment to ask any questions.
Yeah, you know, something that I really resonated with was with Heidi, because well, I'm no longer an undergrad student, but I'm also alumni. And something I was thinking about the other day was what she was saying in terms of funding and resources. So I work in the nonprofit world, and I do advocacy around mental health resources, and that's specifically in the military community. That's a whole nother story full of, you know, stigma around mental health and stuff like that. But something that I've noticed within the system, and this is, I think, from a public policy lens that I'm asking, is that you have a great idea, and in theory, you have the research, right? And at times it is very savior-esque, right? It's coming from an ivory tower that's often disconnected from community and what community needs. And then afterwards, it becomes, you know, passed as a policy, and then there goes into an implementation process where there becomes a program. And then afterwards, you know, it's all about numbers, right? Because if you don't meet your deliverables, the funding, you know, goes out the door. So essentially, you know, when the program gets into action, it's no longer viable. It's not, because again, it's not either it's not marketed well to community, the outreach isn't there, or it's just, again, there's just too many factors within a long-standing history of stigma, right? And how do you solve that in, you know, if it's like 100, 200 years of stigma and trauma in the making? How do you solve for that, right? In a single program that's been that's only in its pilot program for about a year or two, right? So my question for you, and I don't know if this will be a coherent question because it's my thought process in one, it's how do you think public policy should move forward into creating naviable programs that work and don't necessarily focus on the numbers aspect? And I guess how do you divulge in that if you're working within, you know, working within that process? Does that make sense?
That definitely, everything you said. Yes, it totally does. And everything that you said resonates with me. I worked for like 9 years in nonprofit before I ended up going into government, trying to go into local government. And yeah, yes, I mean, I think that's where my passion stems from, is because of my frustration with funders and policymakers, and kind of what priorities are set and what programs are authorized, and the length of grants, and the idea that, like, okay, we're gonna give you $300,000 for 3 years to run this program, but you must pick from these 10 evidence-based programs. And then you have to do all this evaluation and data collection, but we're not gonna give you additional staffing or training to do all of that data collection, or we're not going to give you enough money to then hire someone that has those skills. It makes me infuriated how success is measured currently. And there are some funders that are more open to kind of qualitative data, but it really is what Tiffany said, it's a numbers game. Like, and I hate it. Like, I think, and I've asked this at other conferences, like there's a organization called the California, it's called CPEN. What does it mean? CPHEN. The California Pan-Ethnic Network. And they put on this conference. It's a statewide multicultural health advocacy organization. And they, I asked the question at a conference, if funders are asking for us to measure success in this way, but that's not how our community measures success, is it our job to equip the community with the skills to measure what success is? Or is it our job to change how the funders and the policymakers are defining success and measuring it? And they told me it's both. And so I think in order to move the needle, you have to be doing both at the same time, unfortunately. And you're right, we're not going to erase hundreds of years of oppression, and then the internalized oppression that is passed down, and then the systemic racism that then shapes our institutions through a 3-year, $300,000 program. Like, that's just not going to happen. And so how can we move the needle just a little bit? And so, for example, in the mentoring that I do, is equipping communities to have the skills to then navigate in these systems to get the funding for their communities. So it's my job to learn those skills, even though I think that they're not necessarily relevant to our community sometimes. Like, I have to learn multi-level modeling and structural equation modeling and all these statistics things that, like, will then wow the academics, and then somehow, like, I don't know, whatever. So I have to learn those skills. And some people will call it code switching, but it's like learning how to navigate the systems that we don't want, so that we can change the institutions to be what we want them to be. So, and then working on the CDC and the the government end, on the policy end, I have folks that work for foundations, and having them listen to communities about what success really means for them, so that when they're at the table of being like, who's going to get renewed, and they're looking at the numbers and it's just not reflecting what they wanted to see, that they're acknowledging and rewarding success that are defined in other ways. And so that's where my digital storytelling work comes in, my documentary filmmaking comes in, is that you're able to tell stories that, at the CDC level, all they see are the reports. And, but sometimes there are other ways that you can share story other than just with the numbers. So that is my answer to your question. And I would love to connect with you and continue. So I found you on LinkedIn, and I will connect with you.
Can everyone see that okay? All right. So finishing the night off, I would like to give a huge thank you to our panelists for volunteering their time to join our Alumni Table Talks, Social Justice in Public Health. This conversation was so great, and as you can see, it wants to keep going. You both have such amazing ideas, and I wish I could pick your brilliant minds all night. Your work is so inspiring, and I just want to say thank you. And also thank you to our attendees for participating as well. Anything to add, Edwina?
Just a really wonderful conversation, and thank you all for centering that social justice work that you continue to do and continue to learn through. And it is very heartening to me, knowing that folks like you are in the field and doing this work. And, I've always said, and the folks who are previous interns know, that that's, I think, how we actually change systems. It's that people go in with different and new ways of looking at things and asking questions. And it takes a while sometimes, and it is sometimes might feel like a slog, but eventually there's a tipping point. And just hearing both of you talk, I know that you're in the right positionalities and places in your lives where that's going to continue. So I learned a lot, wrote some notes, and am very proud and grateful that you spent time with us this evening, and that this will be something that students will be able to see who are part of the Cross-Cultural Center and know those stories. And you shared a lot of wisdom. So really, really appreciate both of you for coming.
Thank you, Edwina. I just want to say thank you to everyone for coming, and thank you, Edwina and the CCC, for this amazing opportunity. I feel like I learned a lot from Heidi, and just from the conversation that we had. And I just feel really grateful and just very humbled to be here.
Yes, thank you so much. And then if you could all fill out this survey and let me know how this program went, and it helps my facilitation skills and really helps me know how the program is doing as well. Appreciate that feedback. That's the QR code on the right and the link you can find on the left, the tiny URL. And then the last slide to share is our upcoming program next Wednesday, June 2nd, where Joycey will be talking about social justice and in STEM. All right, I just want
Could you
sorry.
put the URL in the chat? Sorry, I'm using my phone.
Yeah, no problem. I'll go ahead and put it in the chat. And then also if you want to continue asking questions.
Oh yeah, I mean, my question is actually more on the self-care basis. As you know that doing this work, especially social justice work within institutions, it can be quite difficult. So how do you prevent burnout for yourself, and how do you practice self-care?
I can go first. I mean, I didn't prevent burnout because I was burnt out. To be quite frank, it was a lot of working 70 hours a week and not knowing when the pandemic would stop, and not knowing when when the light at the end of the tunnel would be. And starting this job, no one knew. And so all of us on the team at the Department of Health were kind of riding the same wave where we were struggling and trying to find time for self-care, but also having to meet deadlines because, so for example, every week during the beginning of the year, we had a Thursday night deadline, or Friday morning, 6 a.m. or when vaccine orders were due. And if we didn't submit them, then no one in Washington would get vaccines. So there's a very strict shipping and delivery and ordering schedule. And so all of our decision-making had to start, had to work around this deadline. And if this is a weekly deadline, then it's just the pace was just relentless. And so there were times where we were up until, I would say, sometimes 3 a.m, and working like really, really long hours to meet that deadline so that people could get vaccine. And I was able to take some time off. My team has been pretty lenient with rotating like time off schedules, but aside from that, I do a lot of exercising for mental and physical health. I like to run, so I run a lot. I try to go out on a walk and call like my family or my grandma during my lunch walks and just push myself to go outside, because if I don't, I would literally stay inside the whole day and be on the computer screen. And that's something that I had to put in my schedule so that it was routine for me. And I've never done that before. I've never been in an environment where the pace was so fast and relentless, and that deadlines were so high pressure, and the impact of us not meeting the deadlines could be very severe. Going up to the governor and having media and news cover it is like, I've never been in that situation before. And that is something that I had to was forced to get used to. But now that everything is slowed down, I've had more time to, I don't know, do what normally I do, watch shows, continue to go out on walks and work out. What else do I do? I am trying to volunteer for a running club, and just try to take care of myself as well, and talk to friends. And it's been a good, it's been a hard but a good few months. And now that the light is here, and I've been, for the past month, I've only been working for a normal 40-hour work week, which now I'm like, I don't know what to do with all this time. So it's been good. I would say that self-care is really important, and that I now know my limits on burnout. And also it has informed me of what I think of my work-life balance, my ideal work-life balance would be like.
Thanks for the assessment wheel, Heidi. I just did a bookmark. Maybe.
So one of the
hello.
things that I learned, this is Ezekiel. His name is Ezekiel Juan Katarungan Kalitwasan. His middle name, it means justice in Filipino. Appropriately named. I pasted a couple things in the chat. One of them is a personal wheel and a professional wheel, and then a self-care wheel. They're just different assessments that I've learned. They come from a book called Coactive Code. Not create this myself. And to you, but like just having like a self-check every so often is nice to know, like how I'm feeling about my job, and then not just about my job, about how my job fits into my life. And now I'm a mom, I'm a wife, I'm a sister, I'm a daughter, and so knowing that the job is not everything too, and also that self-care is not just the going along the themes of public health. It's not just the preventing burnout is not just the role of the individual. It is the role of our systems. And I think that's something that I learned working at the Cross-Cultural Center, is that they would have us, I don't know if you still do this, whenever we had our one-on-ones, we would do like a weekly compass where we, I can't even remember what the different areas are, like social and mental and something, but just the idea that like, and that's how I do my supervision. And when I mentor my students as well, is that I'm not just concerned about their academic performance, but also about like, how is everything else going on with your family? And I think that's something that we can be better at doing and institutionalizing. And it can just be as simple as when you plan a meeting, that you put a check-in at the beginning that is something meaningful, that allows people to bring their whole selves to the table and not just talk about their favorite ice cream flavor. Yeah, so you know, who is an ancestor that you look up to and that you would like to bring to this meeting? Where do you call home? Things like that. So so that's kind of how I prevent burnout, and to know my limits. I mean, I think at least when I was at UCSD, it was cherished if you did too much, and it was championed. And it wasn't until I was a senior at the Cross that I learned that rest is so important in the revolution. So in order for me to continue going, I need to know when I need to rest, and that it's an act of, I think it's Audre Lorde says that it's an act of, I forgot what the quote is, but
self-preservation.
But yeah,
I think it's self-preservation.
Yes.
Mm-hmm.
And it's a political act.
It's a political act, yes. And so I think cultivating that for ourselves. So I do cycling and running, and I see a therapist, and I get acupuncture, and I eat green smoothies, and it's so that I can do the social justice work that I need to do. And you know, this little thing, knowing that my job isn't everything. So I'll share that a couple months ago when I was trying to get out of the health department because I was scared of getting COVID, I got offered 2 positions, and one was to get a 20% raise, and the other one was another job, and it was a 20% pay cut. But I had to think about which one would make me happier and allow me to have a home life with this child. And it was a really difficult decision because as an immigrant, keep going up and up and up, and you keep striving for the higher thing. And I go counterculture, lower people. I took a cut. I could spend more time with this and keep himself, choosing what's best for you and not just what society says that you should be taking. So, and you know yourself best. So
Great. Well, thanks so much for answering my questions, everyone. And thanks so much for cultivating a great space like this, even if it's virtual.
Thank you for asking questions.
And great job facilitating.
Thank you. I think Octavio.
Yeah, I just want to say that I appreciate you guys coming on. This is all very enlightening as a public health major and also a freshman here at UCSD. I just have a question because I'm just barely starting out, still finding my path in life. But one thing that I really fear is that, as I add more years to my education, as I move up the socioeconomic ladder, like I wonder how you guys like stay humble to yourselves. Like, how do you never forget that you have to serve your community and never forget your roots? Like, how do you, like, what keeps you grounded to the community that you went out to serve? Is my question.
That's a great question. I keep pictures and mementos from my past jobs and of the to remind me that whatever table I sit at, whether it's in a classroom or if it's at a county health department, that I am responsible for and bringing the voice of many people and communities that I've interacted with. Because one of the quotes that one of my community leaders told me was, if you're not at the table, you're on the menu. And so I remember that all the time, and that so then I have pictures and cards that community members have written to me. I keep them on my desk, and pictures that and then of course my artwork reminds me. But yeah, no, I mean, I think it's very easy to just play the rat race and have to pay off my loans and help my parents. But I also have a responsibility to myself and to the community and to my family, but also to the community, the communities that I've interacted with and the folks that I know can't sit at the tables that I am currently sitting at. And finding ways to make space at those tables and groom them.
Yeah, Octavio, that's a really great question. I would say that I think about my roots a lot. I think about my grandparents and what it was like to grow up in San Francisco Chinatown, and how different that experience must have been for a lot of my other team members who are a little bit more affluent, and they have come from different communities. And so I want to say that because I think about that, I think about how like proud my grandparents must be, even though they're not, they don't really know the work that I do. And I want to be able to advocate for my community. And along the same lines, though, something that I started to think about, your question was imposter syndrome. I think that imposter syndrome, it's something that I also struggled with when I got accepted into the program with CDC, and having to work with, high like health departments and CDC and people that are higher in the ladder. For example, we had to work with Microsoft, and I had to give a presentation to the vice president of Microsoft. And I had never met anyone from Microsoft before. And then the first person that I meet is the vice president. And so part of me was wondering, like, why am I qualified to be able to do this right now? And is this something that there's a lot of, sometimes when I am doing my job, there have been some times where I think about the opportunities that I'm given, and then I think, oh, wow, that's really major, or that's huge. And it's easy for like immigrants to think that a lot of times they don't really deserve what they're given. But then I have to remind myself that all the opportunities that I have aren't just handed to me. I did work hard for them. And a lot of the times I deserve them. And so I think it's a great reminder for undergrads that the opportunities that you apply for, they can open doors, and it's also, you are deserving of them. And just being in spaces where you don't feel represented, or in areas that, where people are a lot older than you, or they're like all white. And that's something that I wasn't really used to in the beginning. But at the same time, I realized, I'm here for a reason, and I was selected for a reason. And I'm sure a lot of other young folks who have started in the job field or in the job world are feeling this way. So if you are, I do want to remind you that you are, exactly where you need to be. Like, this opportunity is something that you worked hard for, and it's something that you deserve as well.
Interesting. I'll do one last comment. We had a talk with folks that are in education at the beginning of this quarter, and one of our colleagues, Dr. Leslie Quintanilla, talked about the same question. And she really has me thinking about the idea of imposter syndrome, or do I belong, or how hard have I worked, in relation to like an ethnic studies and social justice construct. Meaning there's something about the system that might make us believe the things that you're talking about, Tiffany, and the things that you were mentioning, Heidi. And I'm thinking really hard about, because I have a couple of opportunities that I have that same thing, even with my age, where I'm like, oh, I don't think I can do that. I'm not able to do that, or that's too high. And I'm really thinking about, like, so Octavia, I hope you think about some social justice work and ethnic studies, and this idea that sometimes the system is making us believe we don't belong, and we know we do, but that coming up against that and staying humble and not feeling like you're bragging, or not feeling like you're, like, being in both those worlds is like true, and being humble with our communities, and at the same time knowing that, like Tiffany said and Heidi said, we deserve these things because we do all the work to prepare for them, and holding both those things at the same time. So she's really had me thinking about the internalization of my own imposter syndrome, and how that even got to be, and how that serves a particular narrative that it would be wonderful if we could break down, because I know everybody on this call has worked really, really, really hard. And you as a freshman, you were at UCSD, that getting into UCSD is a thing. So like I'm trying to reframe that for myself, and thinking about it really hard, because I'm starting to be like, oh, that might be another tool structurally that's being used to maybe make me not do things. So I should ask that question. So I just offer that as well, because it came up at our last roundtable, and I'm still thinking about it.
Thank you, everyone. I want to give our panelists and all of our attendees back your time. Thank you all for coming, and thank you for your questions. This concludes our program. Bye,